Hello, this is a video on atrial fibrillation, its effects on the body, and possible treatment methods. So what is atrial fibrillation? It is disorganized electrical signals in the atrium. An irregular, often rapid heartbeat. It can increase the risk of stroke and heart failure, and the blood doesn't flow well from the atrium to the other chambers of the heart. Signs and symptoms: heart palpitations, fatigue, confusion, shortness of breath, lightheadedness, chest pain, weakness, dizziness. Some people may have no symptoms and it goes undiagnosed until an exam. It can also come and go in episodes or not go away at all. Classifications: there's occasional atrial fibrillation where the symptoms come and go and they last for a few minutes to an hour and it stops by itself. Persistent: the heart rhythm doesn't come back on its own. It needs treatment, electrical shock, or medications to restore the rhythm. Long-standing persistent: continuous and lasts longer than 12 months. Permanent: heart rhythm can't be restored. It often requires medications to restore. Causes: right atrium made up of a group of cells called sinus node, the heart's natural pacemaker. Then the impulse travels through the pathways called the atrioventricular node. As the signal passes, the heart contracts, pushing the blood out. In atrial fibrillation, the atria have chaotic electrical signals causing quivers. The atrioventricular node is bombarded with impulses. Ventricles beat rapidly, but not as bad as the atrium. Not all impulses go through. Atrial fibrillation heart rate is 100 to 175 beats versus 60 to 100. Risk factors: abnormalities or damage, high blood pressure, heart attack, coronary artery disease, abnormal heart valves, congenital heart defects, overactive thyroid, exposure to stimulants, sick sinus syndrome, lung disease, previous heart surgery, viral infections, or sleep apnea. Prevention: a heart-healthy diet, maintain a healthy weight, increase physical activity, limit caffeine or alcohol, avoid smoking, and try and reduce your stress. Treatment: depending on the type of atrial fibrillation, a doctor may prescribe lifestyle changes, cardioversion, medication, surgery, or a pacemaker. Facts: atrial fibrillation is the most common heart arrhythmia. Around 2.7 to 6.1 million people suffer from atrial fibrillation in the United States. More women than men suffer from atrial fibrillation due to their longer life expectancy. The following are a list of sources that I used in the video. If you feel like you have any of these symptoms, please contact your doctor immediately.